So hello everyone. Today we will do part 2 of 29th of April's newspaper, and here we will discuss about the health sector of India, how India has spent on health, and how it's going to save when the pandemic comes. We will also talk about the present Karnataka elections and why Karnataka is important for India or even for uh, the present government. All right, little bit more on it. Now, how India spends on health. Now, over the last several years, spending on private health insurance have been increased. Means because of pandemic and everything, people have started spending more on private health insurance, and the share of people's out-of-pocket expenditure has been decreased. That means people are spending less in the expenditure on the health. Means government is taking care of it, so it's a good step. Now total spend as percent of GDP is 3.3 in 2019, which was earlier in 3.9. Now government spend as percent of GDP. What the government has spent earlier, government used to spend 1.13, but in 2020 government has spent around 1.35. Now out of pocket spending of percentage of, earlier people used to spend 62.6% on their health out of their pocket. Now presently they are spending 47.1, means there has been decrease of around 15 to 20%. And government spend in total, earlier it was 29, but now it is 41, means government is spending on people now. Social security percentage of total, earlier it was 5.7%, now it is 9.3. Private insurance spend as per the total spend, earlier it was 3.9, now it is 7.72, means people are investing in insurance. Now the current health spend as percentage of total health, earlier it was 93.4 and today it is 90.5. All right. And now the government expenditure on health as a percentage of GDP has increased. That means whatever GDP, gross domestic products, India has, its government's expenditure on health on the percentage of GDP has increased. That means, and out of pocket spending by people on the healthcare has been decreased. That means government has taken care. Either the people are not getting that much sick, or people have, or the government has uh, expanded on the behalf of people. So that means throughout the corona there has been lots of problem vaccination, but government has provided free of cost. People don't now people are going to government hospitals regularly. They're not dependent on the private hospitals. So that means people's out from pocket spending has been decreased and government expenditure on the health sector has been increased. All right. The estimates are a snapshot of India's expenditure on healthcare, which we have talked earlier, where by the government, private sector, NGOs, or individual are full of these funds. That means even if we see the private sector, the NGOs, all right, the individuals, or any type of government, private, or any kind of NGOs which are providing health facilities to the people are being in the flow of funds which are provided by the government, because government had made such policies that even at the private firms, if you go, there would be some kind of concession will be given from the government side, or even some healthcare facilities will be provided from the government side. Now the main finding in reports: one, government spend on health care has risen from 1.13% of GDP in financial 2015 to 1.35 in financial 2020. That means there is a shift 0.25 percentage from of the GDP from earlier to now, and the money spent on each individual has almost doubled. That means if somebody if the government used to spend 10 rupees on a person for the health, now they are spending 20 rupees from earlier. And the target of 2.5 investment in healthcare by 2025. That means from 1.35, government has targeted to spend 2.25, 2.5% in the healthcare sector on an individual, and it will likely to shoot up in next year report. That means whenever the next year report will be coming, you will see that there has been shift from 1.35 percentage of GDP on the health sector to somewhere around, I believe, around 1.7 to 1.8 percentage of total GDP. All right. Then the government share its total spending on the healthcare has gone up by 12.4 percentage point between financial year of 2015 and financial year of 2020, increased from 29% to 41%. All right. The people have been spending less from their pocket on healthcare. This is also very important. People are spending less because government is doing on behalf of them, and the aim is to bring down as low as possible by investing in public health and insurance, so people do not have to shell on lot when they are sick. That means it is a beautiful initiative taken by the government. That means they aim that people should spend very less on health sectors. All right. uh, because government can take care of it whenever you are sick. All right. And government versus pocket spend, the proportion of GDP has fallen from 3.9% in financial year of 2015 to 3.5% in financial year of 2020. That means government has spent around 0.7%. There has been drop of 0.7% on the GDP. That means they have spent 0.7% more on people. That's why there has been drop in GDP. And this means there is a decline in consumption of healthcare services. All right. That means there have been decline in the consumption of healthcare services. Our work with NSSO data support this. We saw decline in hospitalization. Means if government is already spending more on people, and people are getting less reliable on the private sectors and private hospitals, there will be less hospitalization. If proper health is taken care, nobody will be going to the hospitals. Now spending on insurance, which is very important for the economics as well. Now increase in, and as Siddhant Mohanty has been the new president of the committee, new chairman of the LIC. Along with that, he will be the new managing director and the chief executive officer in the coming year of 2025. So India will be doing very well in the insurance basis, and it will ultimately affect and affect very effectively in the health sector as well. There have been increase in the spending on private purchase health insurance from 3.9% expenditure to 7.72. That means people are now expending more on their money to the insurance sector. We have to understand, if insurance is there, government will be having more money to sell, purchase, to utilize that money in the infrastructure development. All right, even to pay back the people. And it is a great initiative taken by the government. And we have talked that people spending has in the insurance 3.9% to 7.72 percentage, and 3.8% of total healthcare spending in 2015 to 6.37 of 2020. All right. The purchase of private insurance indicate that people are accepting that this way of forward. All right. That means if people are spending more on insurance, that means people have accepted that nothing can be done, but for the sake of insurance we will provide a greater future to our children. So it is a great initiative taken by the government, and people are fully understanding them. And especially this insurance was usually done by the middle class and the upper middle class people. They're very happy to spend on the insurance. And the state health spending, we have done that. Dr. Paul said data for the report can be used for the statement of design in the health policy and budget. All right. And state must increase healthcare spending. That means the government should increase more on healthcare spending and achieve the target set by the National Health Policy of 2017, which says 8% of state budget should be towards the healthcare. Now presently, I have studied somewhere. I'm tell you again. Yeah, government shares is total money spent on the healthcare has gone up by 12% points between 2015 to 29% to 41%. All right, means government has started to spend more on the people. And there has been healthcare spending of around 6.37, all right, which should be increased to 8% to have that goal which government has increased earlier, all right. What government has increased the goal that by 2025, by 2025 government is likely to spend 2.5 investment in the 2.5% investment in the healthcare sector, and presently they have been doing in 3.35 percentage. 3.35 percentage of GDP they are spending on the healthcare sector. They want to spend around 2.55% of the 2.5% of GDP by 2025, and which has to be 8% of the state budget. All right, that 2.5% of investment would be equal to the 8% of state budget towards the healthcare. Now, right now, except one or two states, the target of 8% has not been achieved. Means only two to state, and most stand at 4.5 to 5% of their budget. That means uh, currently only few states are getting that 8%. Only one to two states. Along with that, 4 to 5% of people are getting. Sorry, 4 to 5% of budget they are getting, and the state has achieved that 8% target in financial year. The report were in Delhi, Pondicherry, Meghalaya, Goa, and Kerala. All right. In Delhi, there is 18.7%, Pondicherry 10.5%, Meghalaya 8.9%, Goa 8.7%, and Kerala 8%. Dr. Mukhopadhyay said the health being a state subject, such much as government spending come into the state, and there is need for the central to provide more support to the states as far as it is required. And we must take example from Rajasthan trying to implement the right to health. The center should be encourage such effort and give them additional funds. All right, and let's move forward. Let's go to the ideas page. Ideas page is good for nothing. Now let's go to the editorial page. All right. In this editorial page, we will study the making India pandemic proof. All right, how India can be more pandemic proof. All right. Now, how ready is the country for the next pandemic? The virus spend expose the weakness of the world's health system. Means not just India but complete world has been very poorly in the system, in the health system, because the virus has exposed, and including those countries which are very high ranking in the global health security index. All right, all those countries have been exposed that there is poor health facilities available, and the climate change is giving rise to new pathogens, and zoonotic diseases are spilling over from animals to humans. Means new pathogens have been found due to climate change, and the diseases have been spreading from animal to human beings. Silent pandemic is also lurking. Antibiotic resistance. The world realized that the cost of preventing a pandemic is far lower than cost of managing one. All right, that means if you prevent one pandemic is better than spending on managing one. All right, one health approach that advises to the health of people, animal, as well ecosystem together. That means a budget should be made on one health policy so that it can take care of the human beings as well as the animals along with the ecosystem which we are living in. Then only health could be benefited. And India is one of the world's first countries to frame a game plan. All right, India is the first country to frame the game plan, and India has launched its flagship program to prevent and prepare and respond to pandemic. All right, means India is launching a new game plan so that it can prevent, prepare, and respond to pandemic as soon as possible. And Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, that is PM Abhim, Pradhan Mantri Ayushman Bharat Health Infrastructure seeks to find the gap at both national and state level. All right, that means how state and national level it could be connected, and this PM Abhim Yojana can be implemented both at center level as well as state level, and it will need to be overseas as highest level. All right, India has also bought several ministries including health, animal husbandry, forest, and biotechnology under the principle of science advisory. Means India has been spending more on health, animal husbandry, forest, and biotechnology. That means ecosystem, the animal's health, and the human health. So under the principle of scientific advisory, okay, it is a good thing. And National Institute for One Health in Nagpur was laid. All right, and India was able to create in short time a formidable network for institute that can identify new pathogens, and complemented with wide testing of wastewater and sample from incoming ships and aircraft. Now it is for the national security because it's kind of proxy war which many countries are doing, like China, and in which the countries from where we share borders and share the water bodies as well. All right, and along with that, the 30 cities accounted for almost 80% of India's reported COVID cases, and shows how vulnerable urban population are to spread of diseases. That means urbanization has affected in spread of diseases. All right, 30 cities, according to 30 cities, have accounted for 80% of India's reported COVID cases. All right, that is major big cities and private hospitals and clinics, which have provided over 60% of India's healthcare. And the private hospitals and clinics have provided around 60% of healthcare to the people. And Ayushman Bharat Digital Health Mission can facilitate this. All right, and new pathogens. This can also be complemented that wider of water bodies and samples from coming from ships and aircrafts. The surveillance system will be needed to extend to other South Asian nations. All right, whatever the South Asian nations we have, there should be a surveillance systems from where these kinds of pathogens are coming from wastewater or coming from ship or any kind of aircrafts. And we and our completely main focus is on the influenza, so that no such dangerous disease could come. Now, the South Korea use mobile technology and big data to trace contact and build a strong capabilities for diagnosis. All right, means South Korea has been using mobile technology to have a strong capability for the diagnosis, and India has also begun these exercises. That means to use the new technology for surveillance as well as to monitor the people and for diagnosing them what kind of problem they are dealing with. Now, during the pandemic, the Indian manufacturers produced vaccines, test kits, therapists, masks, and other items at very competitive price. All right, both for India as well for countries, because Indian manufacturer has been producing these kind of expensive things for India as well as for the countries as well for the competition sake, because it is an opportunity also, and the pandemic brings some opportunities as well. And the partnership between the research bodies and manufacturers will need to be sustained and enhanced to make India a global hub in the biopharma sector. And if we do more this, if there is more research bodies, more manufacturers, then it will help India to become a global biopharma sector. And the national biopharma mission is a positive step towards providing access to affordable new vaccine drugs India and around the world. Similarly, the ICMR initiative to establish the bioresponsory of clinic sample with the national and global asset. All right, it is a global asset because it monitors the people as well as the biosystem as well as the ecosystem. And the World Bank has recently augmented its support for the country's health sector to 3.5 billion. We are working with PM Abhim to build an institution and system for preventing and responding to future pandemic. That means Pradhan Mantri Ayushman Bharat Health scheme, which has been a great initiative by the government to fill up the gap between the countries, that is the nation, as well as the state, which will bring the new changes by building new infrastructure, new surveillance system at the ecosystem. All right, and helping the improving the provision of primary health care by supporting the Ayushman Bharat Health and Wellness Center under the National Health Mission at the center and 7 states. All right, this will help the government in properly dealing with the health problems which have been going on. Now let's move forward and yeah, decision. Now we will talk about the Karnataka. All right, why Karnataka is important, and let's see the timing. How much time is there? Yeah, we can do it. We have 10 minutes. Now, not just about seats, Karnataka is also an economic powerhouse. Why Karnataka in the present election has been going on, and after Karnataka, there will be election in Chhattisgarh as well as in Rajasthan. All right, Chhattisgarh as well as Rajasthan. Three states will be going to have election soon. And why Karnataka is important than Chhattisgarh or Rajasthan? Because Karnataka, it is the fourth biggest economy in terms of GSDP, and the state performs better than the national average on seven markers. All right, what are the seven markers? We will discuss on it, and on those seven markers, there will be an average, national average will be increased, and the state will perform better at national average. All right, and even the Karnataka is among the fourth biggest economy in terms of GSDP. Now, Karnataka election is due, and this year itself. Along with that, there will be election followed to Chhattisgarh as well as Rajasthan. All right. Now, Rajasthan has already implemented great schemes for the health sector. That is, the Congress government has done, because to better it has made that health is right of people, just like education. Now, Karnataka accounting for 28 Lok Sabha seats. Now, Karnataka is presently accounting for 28 Lok Sabha seats. All right. Now, country's economic powerhouse, which contributes significantly to the national GDP. Karnataka is also the sixth largest state in terms of area, and all right, it is sixth largest state in terms of area, and eighth largest by population, and fourth biggest economy in terms of size of its gross state domestic product. Just as at national level we have GDP, gross domestic product, but in the Karnataka is fourth largest economy in terms of the states of India. All right, GSDP, that is gross state domestic products, perform better than the national average on socio-economic indicators such as poverty, literacy rate, growth, inflation, and employment. That means Karnataka has been doing so much better than the state itself. That means the state means the nation itself in the socio-economic indicators like poverty, literacy, employment, inflation, health rate. All right, the growth rate. The what is the economic rate? The GDP, Karnataka's GSDP seeks and rise from 2011 to current 2023, and there was a growth of around 7.6%. In corresponding period, the Indian economy rose to only 7%. That means Indian economy has rose to around 7% in the present time, but the Karnataka has rose from have risen to a growth of 7.6%. That's still 0.6%. It's doing better than the government. All right. Along with that, the Karnataka GSDP growth was slightly lower in the country's GDP growth, as we have already talked. And even during the COVID-19, the state economy contracted 3.53%, which was also lower than 5.83 contract economy than the economy of the country. That means there was less contraction during the COVID time as well. During the COVID time, only 3.5% contraction in the economy was seen in the GDP, while the state, that is the nation, we got around 5.83 contraction. All right, and Karnataka GSDP growth high was higher than these three states, that is Maharashtra, Gujarat, and Tamil Nadu. From these three states, Maharashtra, Gujarat, and Tamil Nadu also, the Karnataka has higher growth rate, that is of around 10.96 percentage. Now, if we talk about the per capita income, the financial year of 2021-22 was more than 1.5% of countries. All right, including the six states, that is the Goa, Sikkim, Chhattisgarh, New Delhi, and Chandigarh, Gujarat, Haryana, and it was having better per capita income as that at that time also. All right, it was better than 1.5% at that time. Now the per capita income growth. The capital income of Karnataka has registered an annual increase in the range of 4.52% to 10.56%. All right, that means per capita income has always been growth. There was around 4.52% to 10.56%. And if we talk about the unemployment, the unemployment rate, the usual was recorded in 3.2% in Karnataka unemployment rate, and all India unemployment rate is same as per as 4.1%. Now Karnataka fared better than the countries in the period, that is 5.6% as compared to 6%, and 2.3% as to 3.3% respectively. Now, if we talk about inflation, the annual rate of inflation based on CPI, that is Consumer Price Index, has lower in Karnataka than in country. That is, inflation is lower, and Karnataka was recorded at 5.58% when the country's figures were 5.56. That means it was still doing better. There was less inflation in Karnataka state. If we talk about the exports, then the value of exports from Karnataka stood uh, at 6.13% of India's total export, and only three states, that is Gujarat, Maharashtra, and Tamil Nadu, were ahead of Karnataka. When it comes to exporting, only three states were ahead of Karnataka, that is Maharashtra, Tamil Nadu, as well as the Gujarat. All right, and the DEFLIC indicator. The Karnataka's performance on DEFLIC indicators named revenue deficit, cross fiscal deficit, and primary deficit have been better than the center. All right, these things were better than the center. The Karnataka revenues deficit, which is defined as excess of revenue expenditure over the revenue receipt, has been lower than the center. That means whatever the revenues they have decided, and their expenditure was lower than what they have decided. So they have saved money. Karnataka has even saved money more than the country. Along with that, in the fiscal deficit, which is difference between revenue deficit and non-debit capital receipt, and the total expenditure, have also been lower. That means the fiscal deficit, which is difference between the revenue receipt, whatever revenue receipts we have, and means what they have planned, uh, plus the non-debt capital receipt, which they haven't. The non-debt means they don't have any debt, and the total expenditure have also been lower than the country. And the primary deficit, which is difference between fiscal deficit and interest payment, has also been low in Karnataka as compared to center. All right, difference between fiscal deficit and interest payment has also been lower. Now, if we talk about the below poverty line population ratio, 20.91% of people were BPL in Karnataka. All right, they have been only 20.91 people of were BPL in Karnataka, and as compared to the nation people who are 21.92%. However, in urban areas of state, poverty is higher than the national figure. And if we talk about the rural background, if we go to urban areas, in the urban areas, the state poverty is higher than the national figure. That means in urban areas, not the rural one. Rural are doing well. The urban areas of the state, the poverty is higher than the national figure. So I think we have discussed more upon it, and we have done more enough, and we will discuss more later on. So thank you, everyone. Jai Hind.